here with Dr Lina at A&L Clinics in Ipswich, and Dr Lina is going to talk to us a little bit more about Botox. I don't know about you, but I've got loads of questions. I don't know actually that much about it, but I'm getting to that age now where I'm considering trying it, so Lina's going to tell us more. So probably best to start at the beginning. So tell me about Botox. What is it used for? What exactly does it do?
Okay, Botox is a natural bacteria-derived toxin which relaxes the muscle only locally, only the muscle which is injected in, so it doesn't travel anywhere in the body. It's really safe to use. In the beginning, that's a little bit of Botox history. It was started to use in the 70s in America. Two doctors discovered that it can be used for some eye tics and neural dysfunction in the eyeball, but they saw the side effects, the reducing wrinkles around the eye, and they thought, aha, that's good. So that's how it started. So it's been used for ages now, and it's really safe and good treatment.
And so, what areas of the face is Botox used for?
Botox is used for different areas, mostly is upper third of the face, which is the horizontal lines of the forehead, the frown lines, and the crow's feet around the eye. That's the most common uses, but it can be used for thinning the face, like for people who have big jaw muscles. It can really slim the face down just by injecting it. It can lift the corners of the mouth nicely, you know, when people have a downward smile. It can reduce the neck wrinkles, so-called turkey necks. It can be used for the jowls, jawline, to make it, you know, smoother. And it can be used for armpits to reduce the sweating, to get rid of the sweating, which is a good use as well. And it's used everywhere in the body basically. I only do it for the face and neck areas, but people do it for the back pains, and it's used for the eyes, so a lot of medical use for that, which is a good thing, you know. It's a proof that Botox is safe and good treatment.
Oh. And is it painful at all?
No, it's not really. I'm using a small tiny insulin syringes, which diabetics use to inject themselves every day, and it's just like a little mosquito bites in the injection areas. Nothing to be scared of. It's like a lunchtime procedure.
So how long does it take, and how long until you see the results from using the Botox?
Okay, how it goes. You come into the clinic and I take your pictures before. I'll ask you to frown and smile to see where the wrinkles are. And after that, I would mark you up with a little pencil and do your injections. It takes about 2 minutes to do injection. It's really quick. And then you get some ice packs to hold on the injection sites. They go down nicely. At first they look like mosquito bites, but in about 10 minutes you can't see that anything's been done. Get the results straight away. Your final result will be in about 10 days, 2 weeks from when you had it injected. And the result is gradual, so in about 3 days you can start seeing that you are frowning less, or you see less wrinkles, and so it goes. And in 10 days you come in, I do your pictures after, show your pictures before, see if you are happy. If you are, that's fine. If not, I'll do your top-ups, which is included in the price.
And so after you've had Botox, how long does that then, the effect then last?
To start with, it doesn't last very long. To begin with, it lasts about 3 months. But then if you have regular treatments every 3 months, in about a year time, it starts lasting up to 6 months. And I have some clients which only have it once a year, so they have to top it up every 8 months approximately, and that's it.
And are there any people who aren't suitable for the treatment?
That would be the pregnant ladies. That would be some neural disorders like Bell's palsy and stuff like that, and people who are allergic to albumin, so that's egg whites basically. People who have protein allergy can't have it done because it is a protein, the toxin.
But pretty much the majority of people it's perfectly safe to use and suitable.
Majority of people are fine to use it.
And what sort of age do you recommend that people start having the treatment?
Okay, the good thing about Botox is that it's not only used when you actually have lines, it can be used for prevention, so you never get the lines. I myself started using it when I was 27 and I didn't really have lines then. But I could see when I was frowning, I could see the frown line coming up.
Yeah, I'm starting to get that.
So that's when I started doing it, and now, now I don't have lines, and they will never develop in the places that I had Botox done. So I won't have any lines on my forehead or around eyes really if I keep the treatment up.
And you look really natural, and I think it's quite rare. I think in the press sometimes people show maybe when people have had too much Botox and their face looks a bit frozen, but you're a great example that you can achieve a very natural look with Botox and you don't have to go over the top.
Well, definitely. If they look frozen, that's over. Then if people notice and ask, oh, have you had some Botox done? That's not a good thing. That's not the look that we're aiming for. You need to look natural after the treatment, like you've been on holiday or eaten very well for some time. That's the thing. Just natural, youthful look. No frozen faces here. Sorry, the ones who like the look.
And you did lots of training in Harley Street, didn't you, in London? Brilliant. So you've brought your training here to Ipswich, and it's quite a lot more affordable than the prices that are charged in London as well.
Yes, definitely. I always go to conferences and all the new meetings about the facial stuff, so yeah.
So how much does it cost to have Botox here?
One area of Botox, which would be like a frown line or forehead lines or crow's feet, is £185. 2 areas is 260, and 3 is 330. So the more you have, the cheaper it is.
And then obviously the longer it lasts between when you need to have the top up. Brilliant. Thank you, Lina. I've learned so much about Botox.
That's good.